Hi Equals, it's Kim. This is the second time I've shot this particular video. I meant to have it up last Friday, but technology stuff happened and it wouldn't come off my phone. Interestingly enough, it kept coming up with an error. Technological problem. So I'm reshooting this morning. It's now Sunday morning. This will be my Tuesday video at this point. So what I was talking about last week was LGBT health because I attended the second birthday anniversary of the Equitas Health Institute, which is kind of the research education arm of Equitas Health. If you don't know what Equitas Health is, I will link their website below. But they are a FQHC lookalike. So FQHC is a federally qualified healthcare facility, and they're a lookalike because they haven't quite jumped through all the hoops yet. So they're called an FQHC lookalike. If you are an FQHC, you have to be serving an underserved population. And so Equitas Health serves the LGBT population. I mean, they serve everyone because we don't discriminate based on sexual orientation. But their focus is on LGBT people. And last week was the second birthday celebration for their education arm. And since I'm kind of do education, LGBT education, it made sense for me to go. But I was remembering back when Equitas Health used to be AIDS Resource Center. Before that, they were something else. So they've changed their name a few times as they've evolved in their services. And I remember several years ago, I did some video for them. Don't know whether it could still be found on the internet. Maybe I'll go looking for it, and if I can, I'll link it. But they were doing video interviews with a number of people about the need for LGBT, culturally competent, culturally humble medical and therapists, providers. I told my story, and I actually have a couple of them, and I will tell them real briefly. But the first happened years ago when I was in the Toledo area, and granted, I was going to see a resident at a medical school, because at the time I was cheap. And so I was just going to the local healthcare center, and they were staffed by residents for the most part. And this woman was a resident. Now, she was actually closer to my age, which means she was probably a non-traditional medical student. Ladies out there, you'll recognize some of these questions. If you've never seen a doctor before, they're going to ask you a series of questions, like, are you on any medication? In which case I was saying no, I was there for a thyroid condition. Are you on any medication? Are you sexually active? And if you said no to the medication and then you say you're sexually active, then they're like, well, shouldn't you be on birth control? And I said, well, no. And she said, so why? She asked the question, so I answered her, because I'm in a lesbian relationship. She got real funny, and she stood up and walked out of the room and came back with her attending. So this guy was probably in his 60s, white, and he repeats the questions. And I repeat my answers. Now, this is me. I do this professionally. I'm a little bit more willing to put up with that kind of thing than just your average LGBT person out there. So I was kind of curious about what was going to happen next. And basically, they left. I'd had some blood drawn. I had to go back a month later and get the results of that blood work. And when I went in, or actually, I went in the room first. When the intern came in, same woman, the first thing she said was, I owe you an apology. And I was like, wow, well, this is interesting. And she continued to say that at our last meeting, she thought that I was giving her information she didn't need to know. And she felt, I don't know exactly how she felt about it, but whatever it was, she felt I shouldn't have told her. Anyway, she proceeded to say that in the month since I'd been gone, she had been educated otherwise. That yes, she actually did need to know that information. There are some healthcare differences for folks who are LGBT. I'm not going to go into that. I'm not a doctor, but they involve, mammograms, prostate, sexually transmitted diseases, cancers. Some of those vary depending on your sexual orientation or gender identity. So anyway, what I was told was that because I was in a same-sex relationship, I did not necessarily need to have a pap smear every 3 years. Pap smears are designed to detect HPV, which, by the way, is a sexually transmitted disease, and like 60% of the population is carrying it. And then she said, but I would need clear pap smears for 3 years, and then once I had that, then I wouldn't need a pap smear every year. I was like, yay. As it turns out, down the line, many, many years later, I got a pap smear that came back positive for HPV, the cancerous kind, and about 2 years later was diagnosed with cervical cancer. I'm a 5-year survivor at this point. Yeah, from my experience with HPV is that it can sit in your system for like 20 years. That is the only explanation I have for how I got it. It was something I picked up in college. I still recommend a pap smear every year if you've ever engaged in opposite sex intimate relationship. Anyway, so that's one of my experiences, and that woman, that resident, really should have gotten that education that she got in the month between my visits. She really should have gotten that education before I walked in that office. And so one of the things I advocate for is LGBT health as a required curriculum in med school. So there's that. Also, when I had a radical hysterectomy as part of my cervical cancer treatment, and so I spent 5 nights in the hospital. And for those of you who've been in a hospital overnight before, they come in the middle of the night and they want to take your temperature and check your vitals and all of that kind of stuff. One night, I don't remember which night, I was on morphine, folks, but one night this male nurse, he was from a foreign country, came in. Mary, my spouse, not at the time, but my spouse now, was sleeping on the couch in the room overnight, and this guy wanted to have a conversation. I'm on morphine. It's the middle of the night. He wants to have a conversation about my relationship with the woman sleeping on the couch. It was really kind of strange. Again, this is what I do for a living. I'm a little bit more willing to do education. When I've had surgery and I'm in a hospital and I'm on morphine, I shouldn't be the one having to educate this nurse about LGBT people. They should get that education in their college curriculum. That's my rant about public health. Since then, I've always choose a doctor who I know is LGBT competent. Equitas Health has a provider network. I'll try to link that too. A booklet that gives you a list of LGBT culturally competent providers, as well as does Columbus Public Health. If there are other places you know of around Ohio, or anywhere for that matter, that has one of those similar listings, add it to the comments below so that people can see it. Have a great week, folks. Bye, equals.